It's time for your Eye on Health report. Getting plenty of sleep is crucial for the health and development of a young child, but it's common for some kids to experience sleep issues at some point in their childhood. In today's Eye on Health, Dr. Veronica Sesi is back with us in studio to talk about some of the different pediatric sleep disorders and what causes them. Also, more importantly, what you can do about it.
Sure. Thank you
Thank you
having
for
me,
being
Terrence.
here.
Thank
Glad to
you.
have you.
Yes,
So
thank
this
you.
is something that is rather common.
Yes,
Okay.
yes, yeah. There's so many different disorders that children can experience. Some that are exclusive to childhood, but a lot that occur in adulthood, and we just kind of don't think that kids can have these different conditions. So they can stem from a dysregulation of the inner clock. So we can see things as significant as delaying of the sleep, so delayed sleep phase syndrome, which is quite common in like adolescents and teens. We can see disruption of sleep at night with conditions like parasomnias, like our night terrors, and body rocking and sleepwalking, a little more common in younger kids. Sleep disordered breathing, we can see in about 4% of kids, and that's what we had discussed before, like obstructive sleep apnea, so fairly common in young kids too. Restless legs is a condition that often can occur in kids, about 4% of kids, and typically that's something that can be missed because we think of it as growing pains. But there's several different disorders that we can see: childhood insomnia, insufficient sleep, so several different things.
Yeah, that's a very long list, and
Yes,
I really didn't know
yes.
that many could be applied to
There's
children
more,
specifically.
yes.
So how do you know if you're dealing with a medical condition versus just a fussy child that doesn't want to sleep?
Right, so it's hard because a lot of times kids can manifest as being fussy or irritable or have attention deficit issues or concentration problems, and it can relate back to a sleep issue. So it's very important to look at sleep quality, amount of sleep a child is getting, and really if you can try to monitor their sleep at different points. I have a lot of patients that tell me, you know, kids are sleeping in a separate room, so it's really not until they vacation together or share a hotel room together that they notice that their kid might be very restless or kicking or mouth breathing or sweating in sleep or having some nighttime awakenings that would be unexpected, or again things like sleepwalking or movements within sleep. So it's important to monitor our habits at night, as well as see, is it manifesting with different conditions during the day? Is your child tired? Is your child hyperactive? Are we having trouble with attention, concentration? Are we having trouble with learning? Are we having trouble with processing things, growth and development? All of this can be impacted by poor sleep.
Now, I know some of these obviously are medical conditions.
Yes.
Are there cases where sometimes things can be triggered, like giving children iPads? I know a lot of times
Yes.
that can lead to insomnia in some cases.
Yes, yes, definitely. And so iPads, electronics in general, like any light stimulation, can affect our natural hormone release, and melatonin is impacted, and that can really delay our sleep time. So that's kids and adults, but kids are a little more sensitive in the fact that a lot of them are prone to delayed sleep, more teens and adolescent years, and that's very often associated with hormone changes. So we don't know the exact cause, but we know that light regulation impacts that. So other things too, simply just not giving a child enough time to sleep. So, you know, we think about a lot of these kids may have after school activities, and some sports don't end until late evening hours. So, you know, we're really not even giving a child enough time to actually get the appropriate amount of sleep. So there's a lot of things that can provoke it. You know, other things too, like if kids are doing things that are stimulating or drinking caffeine, you know, things like that, that can of course impact sleep as well.
Are there things that parents can do ahead of time before they go in to actually get a diagnosis if they're just still not exactly sure if they need to do that?
Yes, again, just keep a sleep log, you know, maybe see how much time, like how much time is your child actually sleeping, and then know what is their quality of sleep like when you do observe it. How are they during the day? What are their behaviors like? What is their academic performance? And then, you know, what's happening with their growth and development. You know, we have some kids that are simply just not growing as expected, and that might trace back to sleep. Childhood obesity, you know, if there's issues like that, we look at how sleep can impact that, and there's a strong correlation between lack of sleep and obesity. So, you know, different conditions that your child may have might make us suspect that there might be a sleep issue.
Now let's speak to the dangers of ignoring this, because it could be bad for the child, but also the
Right.
parents too, because if the
Right.
kid's up, no one's sleeping.
Exactly, yeah. So I mean, the beauty of this is treating a lot of these conditions. You can often eliminate them, you can improve them, and you can control them in different ways. And when we improve a child's sleep, we really improve that of the whole household. So, you know, there's a lot of disruptors that can, again, interfere with growth hormone regulation and also like interfere with that attention and concentration issues. There's some links with restless legs. You know, about 25% of these kids may have ADD, ADHD. Some studies show about 50% of kids with ADD, ADHD have underlying sleep issues. So it's important to screen for those reasons.
All right, Dr. Sesi, always insightful. Thank you so much.
You're welcome.